Bony thorax consists of 12 pair of ribs, sternum, and 12 thoracic vertebrae. Sternum consists of manubrium, body, and xiphoid process. It is also a flat and narrow bone. Manubrium is the upper part of the sternum, and it consists of the first costal facet for articulation with the first rib. There is also jugular notch, which is a depression at the superior border. The depression on each side of jugular notch is the clavicular notch for attachment with the left and right clavicle by sternoclavicular joint. Sternoclavicular joint is a type of synovial joint and classified as diarthrodial joint as it allows gliding movement. Next is the body, the longest part of the sternum, which is approximately 4 inches in length. The body of the sternum has an attachment to the second until seventh pair of ribs. The sternal angle is the junction between the manubrium and the body of the sternum. They are connected by the manubriosternal joint, which is a synchondrosis type of joint. Lastly is the xiphoid process, which is composed of cartilage. It will ossify by the age of 40. It has attachment only with the body of the sternum by xiphisternal joint, and it is a type of synchondrosis joint and also attached with abdominal muscles and diaphragm. Next, for ribs, there are 12 pair of ribs and each rib connect posteriorly with the thoracic vertebra. Ribs are also flat bone and mainly help in respiration. True ribs are ribs that directly attach to the sternum through their corresponding costal cartilages by sternocostal joints. The first until seventh ribs are the true ribs. Fourth ribs, on the other hand, are ribs that do not articulate with sternum directly. They are the 8th to 10th ribs, in which their costal cartilages attach to 7th costal cartilage by interchondral joint. Next is the floating ribs, which are the 11th to 12th ribs, and they do not articulate with sternum at all. Vertebral extremity of rib, which located at posterior end of rib, typically have superior and inferior articular facet, head, neck, tubercle, costal angle, and costal groove. The sternal extremity, on the other hand, attaches to costal cartilage, which will then articulate with the sternum. The rib cage helps to protect the thoracic organ, attach to muscles, and move supero-inferiorly and antero-posteriorly to help with breathing. The first rib is the widest, shortest, and has the sharpest curve of all the ribs. The head only articulates with the body of the T1 vertebra, and therefore there is only one articular facet. As in the typical ribs, the tubercle has a facet for articulation with the transverse process of vertebrae. Next, for the second ribs, the second rib is thinner and longer than the first. There are also two facets present on the head to allow articulation with the T1 and also T2 vertebra. It has also a tough tuberosity on its superior surface, which is the serratus anterior tuberosity. And for the 10th, 11th, and 12th ribs, they have only one facet and they only articulate with a single vertebra. The 11th and 12th ribs in particular are short and have no necks or tubercles. Thoracic vertebrae is located between cervical and lumbar spine. It provides posterior attachment for the ribs, some thoracic wall muscles, muscles of the upper limb, abdomen, and also back. It consists of 12 vertebrae that are distinct in shape and function from others. The bodies of the thoracic vertebrae are medium-sized and heart-shaped. They also possess articular facets on their sides for articulation with the heads of the ribs by costovertebral joints. Costovertebral joint is a synovial type of joint. The lower rib facet articulates with the upper costal facet of its own vertebra, and the upper rib facet articulates with the lower facet of the vertebral body above. For the articulation, the first 7 pair of ribs articulate with the manubrium and body of sternum. The sternum has 7 pair of facets which located laterally along the manubrium and body. These facets will articulate with costal cartilage of each ribs. The first pair of facet is located just below the clavicular notch and will articulate with the first pair of rib. The second costal cartilage articulate with sternum at the level of sternal angle, and the 3rd to 7th costal cartilage of rib will articulate with the remaining facets located along the lateral side of body of sternum. These articulations is formed by the sternocostal joint. There are 14 sternocostal joints in total. The sternocostal joint of the first rib allows no motion, or it is classified as synotrodial joint as it attaches directly to the manubrium with no synovial capsule. The second to seven sternocostal joint are synovial joint, allowing movement, or classified as diarthrodial joint. Next is the costochondral joint, which is formed by the sternal extremities of ribs to their corresponding costal cartilage. It is a type of sinusoidal joint, and there are 24 costochondral joints in total. Interchondral joint, on the other hand, is a type of synovial joint or diarthrodial joint permitting gliding movement. It is formed by the costal cartilage of 7 to 10 ribs, in which the costal cartilage of 8 to 10 ribs are attached to the costal cartilage of the 7th rib. And lastly, costovertebral joint, as mentioned earlier, is formed by the articulation of the head of the rib to the thoracic vertebrae posteriorly. For ligament, the main ligamentous attachment to the ribs is the costotransverse ligament. This is a fairly complex ligament. The hyaline cartilage-lined medial rib facet forms a synovial joint with the tip of the transverse process, which is reinforced by a capsule. The lateral rib facet is attached to the transverse process through three ligaments. The first one is known as the costotransverse ligament, which attaches the back of the neck of the rib to the front of the transverse process. The next group of fibers are known as the lateral costotransverse ligament, which lies posteriorly and attaches the transverse process of the vertebra to the lateral facet of rib, just distal to the tubercle. And the final part is the superior costotransverse ligament, which attaches the neck of the rib to the underside of the transverse process. And the lower two ribs are only attached by ligaments and do not form synovial joints with the transverse process of the vertebra. The biomechanics of ribs. The ribs move during inspiration and expiration to either expand or compress the chest. The diaphragm also moves up and down to increase or decrease the volume of chest. The movement of ribs can be explained through bucket handle movement or palm handle movement. First is the palm handle movement. By looking at the rib cage from the side, it can be seen that the ribs which unite with vertebrae form the axis of the palm, and the ribs forms the handle of the palm. During inspiration, the antero-posterior diameter of the thorax is increased as the ribs are raised. Because ribs slope downward towards the sternum, any elevation of the ribs during inspiration causes the sternum to move upward. Movement at the costovertebral joints result in raising and lowering their sternal ends, indicating palm handle rib movement. The first to six ribs are primarily involved in this movement. During expiration, the antero-posterior diameter of thorax is decreased as the ribs lower down to decrease the volume of the chest. This elevation and depression of the ribs over the axis give the impression as if the palm handle is moving. And next is the bucket handle movement. During inspiration, the transverse diameter of the thorax is increased by the ribs swinging outward, indicating bucket handle rib motion. The 7 to 10 ribs are primarily involved in this movement. During expiration, transverse diameter of the thorax is decreased. This is because the weight of the thoracic walls causes the lateral diameters of the thorax to return to the relaxed position.
So now we'll be move on to the next part, which is how can the rib cage perform its function. So in general, the rib cage will be attached to the sternum anteriorly, and it will be attached to each thoracic vertebral column inferiorly. This can help the lung from over expansion. So first, we will go to the first part of the function of the rib cage. So first, the rib cage will protect the internal organ of ours, which is the heart and the lung. This is because each of part of the ribs will cover the lung and the heart while attached to the sternum and also the vertebral column. So next, the rib cage will support the movement of lung during inspiration and aspiration. So during inspiration, the rib cage will move anteriorly, while during the expiration, the rib cage will move inferiorly. Also, when our body are moving forward or backward, the ribs will also move whether anteriorly or posteriorly because of the spinal flexion. So
So
just
just
now
now
we
we talk
mentioned
about the
the
movement of the rib
support for the
cage.
movement of the rib cage.
So
The
so
movement
the
of
rib
rib
cage
cage will
also needs
also
some support
assisted
for them
by the
to move
muscles
that
anteriorly,
were
posteriorly,
extended.
and inferiorly.
Not
So
extended,
in this case,
attached.
there is muscle that attached to
So just now
the
we talk
rib
about the
cage
movement
to
of the
help
rib
the
cage.
expansion
So
of the
the
rib
movement
cage
of rib
itself.
cage
Will also assisted
so
by the
the
muscles
attachment of
that
this
were muscle
extended,
helps them to flex
not extended,
during the
attached.
breathing.
So just now
Now, moving on to physiology of muscle contraction. We have four types of muscle that are found in ribs, which are diaphragm, intercostal muscle, subcostal muscle, and lastly the term versus thoracic muscle. These four muscles have their own roles, especially in respiration process. The first one is diaphragm. Diaphragm is a dome-shaped muscular partition separating the thorax from the abdomen in mammals. It plays a major role in breathing, as its contraction increases the volume of the thorax and so inflates the lungs. The next one is intercostal muscles. The intercostal muscles are a group of muscles found between the ribs, which are responsible for helping form and maintain the cavity produced by the ribs. This muscle assists with expansion and contraction during breathing. This muscle also consists of 11 muscle trios in humans. The third one is subcostal muscle. The subcostal muscle are the thin muscles found on the inner surface of the posterior thoracic wall, bridging two or three intercostal spaces. Their posterior surface lie over the inner surface of the ribs and the internal intercostal membranes. The anterior surface of these muscles are in relationship with the endothoracic fascia and the parietal pleura. The last one is transversus thoracis. Transversus thoracis, also known as sternocostallis, is a muscle found on the inner surface of the anterior chest wall. It belongs to intrinsic muscle of the chest wall, along with the intercostal and subcostal muscle. Transversus thoracis is organized into several slits that radiate from the body and separate process of the sternum toward the costal cartilage of ribs 2 to 6. As I mentioned before, these muscles are responsible in respiration process. Now, let's take a look at how diaphragm and intercostal muscles work together during inspiration process first. When the diaphragm contracts, it moves inferiorly toward the abdominal cavity, creating a larger thoracic cavity and more space for the lungs. Contraction of the external intercostal muscles move the ribs upward and outward, causing the rib cage to expand, which increases the volume of the thoracic cavity. Due to the adhesive force of the pleural fluid, the expansion of the thoracic cavity forces the lung to stretch and expand as well. This increase in volume leads to a decrease in intra-alveolar pressure, creating a pressure lower than atmospheric pressure. As a result, a pressure gradient is created that drives air into the lung. The next one is expiration process. This process is passive, meaning that there is no energy required to push air out of the lung. Instead, the elasticity of the lung tissue causes the lung to recoil as the diaphragm relaxes, making the thoracic cavity become smaller. The external intercostal muscle also relaxes following inspiration, moving the ribs downward and inward. In turn, the thoracic cavity and lungs decrease in volume, causing an increase in interpulmonary pressure. The interpulmonary pressure rises above atmospheric pressure, creating a pressure gradient that causes air to leave the lung. Now, let's take a look at the other two muscles that also play their roles in respiration. The function of the subcostal muscle is to assist the respiration by pulling the ribs inferiorly during forced exhalation.
as well as to support the intercostal space and thoracic cage. Subcostal muscles belong to the accessory respiratory musculature as their function is to depress the ribs during forced exhalation. This action enables them to push the rib toward the central axis of the thorax, which then compress the lung, pushing the air out of them. And for the transversus thoracis is an accessory respiratory muscle that is active during forced expiration. It pulls ribs 2 to 6 toward the sternum during forced expiration, which results in depression of those ribs. This action consequently decreases the anteroposterior diameter of the thoracic cavity. This is a diagram of a rib cage. We can see all the ribs articulate posteriorly with its corresponding thoracic vertebrae. The ribs include the true ribs, false ribs, and also the floating ribs. Beside the thoracic vertebrae, we can see the lumbar vertebrae in this diagram. The depression on the superior border of the manubrium, which is called as a jugular notch, is at the level of T2 to T3. The ribs 2 to 7 articulate with the body of the sternum, and the most inferior part of the sternum, which is an cephalic process, can be seen articulate with the body of the sternum and doesn't have any rib attachment on it.
So now we are on the last part of the presentation, which is the basic radiograph projection for the ribs. So for the ribs, we have two projection, which is basic to be done. So firstly is the epiribs. It can be either being demonstrated bilaterally where it shows both sides of the rib cage, left and right, or we can do it in unilateral, which is can either show the left side of the rib cage or the right side of the rib cage. It depends on which part of the fracture that might have been detected by the doctors. So lastly, the next basic projection for the ribs is oblique. It can be either anteriorly oblique or posterior oblique. So for my example, I took a picture of left anterior oblique, which is the left part of the body is near to the IR. And that is from us. Thank you. So this is the reference that we use to do our slide.